my batchmate as well as my long-term associate, Dr. Ananda Wijayakrama, as the chief guest of the day. Dr. Ananda Wijayakrama graduated from the Faculty of Medicine, University of Colombo in 1991 and subsequently obtained MD in Medicine from the Postgraduate Institute of Medicine, University of Colombo in 1998, MRCP UK in the year 2000 and the fellowship from Ceylon College of Physicians in 2009. He has been working as a consultant physician at the National Institute of Infectious Diseases since 2003. He has undergone special training in many infectious diseases, including dengue, SARS, HIV, avian flu, and other emerging infections. His research interest includes clinical management of Covid19, dengue, HIV, and chickenpox. He is a member of the WHO Guideline Development Group for the Living Guidelines for Covid-19 Therapeutics and Clinical Management, member of the Task Force for Covid-19 Management in Sri Lanka, and a member of the editorial board of the Guidelines for the Management of Dengue Fever and Dengue Hemorrhagic Fever in adults in Sri Lanka. He has several publications in peer-reviewed journals. He has delivered Dr. Cyril Fernando Memorial Oration and Professor P.B. Fernando Memorial Oration at the Ceylon College of Physicians. He has won ProMed Award for Emerging Infectious Diseases in 2016 and President's Award for Scientific Research in successive years of 2016, 2017 and 2018. He was the immediate past president of the Ceylon College of Physicians. He is a frontline expert in managing COVID-19 epidemic in Sri Lanka. He always upholds solid scientific stand towards COVID management and guides the medical community accordingly. So now let me invite Dr. Ananda Wijayakrama to address the audience. Over to you.
Good morning. Thank you very much for those kind words of introduction. Dr. Ananda Patirana, President, Sri Lanka College of Cardiologists. Guest of honor, Dr. Stephen Ethenbeck, Ms. Mendy Wikramasinghe, though he has left us, and the orator today, Mr. Sohan De Silva. Council members, ladies and gentlemen. It is indeed a great pleasure and a privilege to be here in this important event in the calendar of Sri Lanka College of Cardiologists. When Dr. Patirana said he wanted to invite me as the chief guest, I was taken aback for a while. I thought it is something meant for all people. And then I had the sudden realization that I too am old. Though Pati is not as old as I am, we were batchmates, hostel mates, and we studied together. And then we worked together during our foreign training too. And at that time our families were together and our kids grew together. So therefore when Pati invited me, I was not in a position to refuse the invitation. In addition, cardiology had been close to my heart. My first post-intern appointment was under Dr. Ruwan Ekanayaka at Karapiti Teaching Hospital. And my foreign training was with Dr. Pulu Jayawardena in the UK. These two giants in the field not only trained me, but also inspired me with the way they build their units. I'm sure that inspiration helped me when I was building the infectious disease hospital to the present day National Institute of Infectious Diseases. There are many others too, and I'm sure several of them are in this audience too, who have built specialized units in their fields, often with little support from the Ministry of Health. Over the last 30 years, we have seen a tremendous improvement in the curative healthcare system in Sri Lanka. We have seen opening of new medical and surgical units, cardiology units, neurosurgical units, and etc., etc. And many of these improvements were because of the efforts of individual professionals. In a stark contrast to professionals in economics, medical professionals as individuals and as groups have done a very commendable job to improve their specialized services for the public of Sri Lanka. However, now the situation is different. We are in the middle of a pandemic. We, as medical professionals, have a much bigger role to play. This is true irrespective of your chosen field, whether it is infectious diseases, cardiology, neurology, or surgery. I believe we have a much bigger role to play. On the one hand, we have to ensure that the patients are getting appropriate care irrespective of their COVID status. At the very beginning of this pandemic, because of the fear instilled into our minds by the rapid spread and by the high number of deaths, there was a dilemma in our mind of what we can do and what we should do for our patients. This BBC article written in April 2020 aptly described the situation. It goes on to say, rarely has the threat of disease occupied much of our thinking. For weeks, we saw posts in all media, social media, and everywhere. And then it goes on to say, as others have already reported, this constant bombardment can result in heightened anxiety with immediate effects on our mental health, and so on. And the author continues to say, but with the constant feeling of threat may have other more insidious effects on our psychology. Due to some deeply evolved responses to disease, fears of contagion led us to become more conformist and tribalistic and less accepting of eccentricity. Our moral judgments become harsher and our social attitudes more conservative. This article from Bangladesh describes the situation there. It concludes saying, the presence of a moral dilemma in the pandemic situation of clinical care requires institutional authorities to exercise tolerance of individual physicians' moral decisions about the duty of care. Hospital or government authorities should respond to such decisions without introducing immediate sanction, such as suspension from all clinical duties or termination of licenses, and instead arrange for alternative clinical duties consistent with routine medical care. Now that is from Bangladesh. But if you look at the right side of this slide, it gives an example of similar articles written on this subject. However, we saw a change in the minds of our health professionals. As leaders of the profession, we led from the front to minimize the issues faced by patients due to this fear. I must say, I was very happy to see how several young cardiologists who were assigned to our hospital worked during this period, doing everything necessary for patients irrespective of their COVID status. They were true examples to others. But I believe as health professionals, we can do much more. You may look at this entire thing with only a negative viewpoint. You may see negativity in everything. On the other hand, one may see positive aspects also. Sri Lanka has faced few instances of crisis situations during the last 100 years or so. And I think these are the main crisis situations we had. And I believe we handled the immediate crisis quite well in these situations. But however, did we handle the issues coming from these crisis situations well? Especially if you are talking about JP insurgency, tsunami, separatist war. Have we handled this post-crisis situation or the continuing crisis situations after that? I'm sure in this instance, we can do better. So what can we do? I'm sure we can do a lot as institutions, as individuals and as families, and also as professionals. At our hospital, as an institution, we did a lot of improvements in patient care. And we trained our health staff, and also we trained health staff in other hospitals too. And also, we have been doing some clinical trials, studying treatment for COVID. We have been doing a lot of motivation to healthcare workers and general public too, and doing advocacy and also involved in preparing guidelines for patient management, vaccination, and so on. Not as an individual by myself, but as an institution. So we had the pleasure, though it was an anxiety at the beginning, of managing the first patient in Sri Lanka. And then we had a lot of support from other people. This is Air Force was building a ward complex for the hospital. And we got some engineers supporting us to have a CT room donation, and our PCR lab, again a donation, and another donation for nursing quarters. And all this is because of the teamwork we had. So as an institution, I believe we did quite well. And if we talk about families, I think it has been quite a difficult time with all these restrictions, closing down and so on, for families, especially with young children. This one of the clinical psychiatrists say, family resilience, the capacity for a family to weather and even thrive during adversity, depends on a family's ability to balance stability and flexibility in changing circumstances. This work in progress calls for an attitude of, we are all in this together and let's do the best we can. Still, the families face various issues, parenting relationships and constructive dialogue, which can use this opportunity for the betterment of the relationship and the families, and addressing sibling issues and conflicts which can be difficult at times, and protecting yourself and the person who care for, especially with our old parents at home, caring for somebody who is clinically extremely vulnerable. And a lot of our old parents have multiple comorbidities. And then maintaining our own health while we are looking after the others. When it comes to professionals, I think we have a distinct and a very wide role. And we are the leaders of our respective teams. And we can give the directives for innovations and inventions and research. And we can be examples to the public and provide encouragement to the public and advocacy to the public, and maybe advocacy to the government too. Of course, when we talk about new thinking and innovations, initially the most of the inventions were addressing the panic created by this, especially for the safety of healthcare professionals. You can see the right side picture shows something made to take samples for PCR, and then food trolleys made in the UK. But such things distanced us from the patients, and we lost the human touch, and we never use this in our hospital, because I believe in clinical care we need the human touch. And then therefore these inventions do not last long. This was an article written by one of the engineers, and he says inventions coming and going when the dust settles, what may we have? Which highlights the importance of having inventions which will last for a long period. And he says one big hope with the virus is that it would enable creating an ecosystem for the inventor and researcher to take on the mantle of leadership for innovation. When it comes to research, just to quote some examples, there are many research. These are listed in the clinical trials, listed in our clinical trial registry. All were done in some. These are some of the studies related to done in Sri Lanka. So we can be happy to see that there had been many trials done, some happening in our hospital and some in other places too. But of course, there's room for improvement. And then when we come to advocacy, of course, it is important to provide that to the general public and the government too. How it can be tricky, not only in Sri Lanka, in other countries also. This news article says one leading scientist, Sir Jeremy Farrar, stepping down from the scientific advisory committee in the UK very recently. So such things happen. And this is a recent Lancet article about the changing face of medical professionalism and impact of COVID-19, written by Professor Andrew Goddard, who is the president of the Royal College of Physicians, London, and Mumtaz Patel is the global vice president of the college. And they goes on to say, advances in technology and science have changed the way health professionals interact with patients, and democratization of knowledge and increased accountability that come with changing patients and societal expectations have added to the demands placed on physicians. Morale among doctors is generally declining and burnout is rising. That's the situation in the UK they were referring to especially. And they continue to say, COVID-19 has tested doctors and healthcare workers to the limits of their professional competence and taken a considerable toll on their health and well-being. Core principles on medical professionalism, that is primacy of patient welfare, patient autonomy, and social justice, have been challenged during the pandemic. COVID-19 has shown that we must move away from the model of medical professionalism that can lead to moral injury and towards one that provides proactive support for professionals in a systematic way, and it is focused on supporting moral repair. We need to ensure that we as a profession support our doctors and promote ways of working that incorporate the doctor, the patient, team, healthcare organization, workplace environment, and health systems. Over time, this wider system approach will lead to greater cohesiveness within the healthcare and support individual professionals in a safe, more sustainable way. Therefore, ladies and gentlemen, I believe we need to move away from limiting ourselves to the traditional role of treating patients to play a bigger and wider role for the betterment for the people. And as leaders of the profession and as a leading organization, I think it is our duty and the mandate. Thank you.
Thank you very much, sir, for the talk, and thank you for your valuable time as well. I'm sure we are. It's definitely an honor to have you in our presence because you are one of the heroes of the pandemic in Sri Lanka. So thank you very much again. And another round of applause to Dr. Ananda Vijayakrama, please. So the last couple of years has been a turbulent time. I think there's no doubt about it for the world, and Sri Lanka is no different. And the Sri Lanka College of Cardiology has as well had quite a few challenges in running the show for the last 2 years. So the next item on the agenda is the presidential address. However, prior to that, could I ask Dr. Aniddu Pathirana, the current president of the Sri Lanka College of Cardiology, to present the medal to the immediate past president of the Sri Lanka College of Cardiology, consultant cardiologist, Dr. Sandy Amarasekara. Thank you very much, sir. And the next item on the agenda is indeed the presidential address.
So, thank you, Chairman, once again. So,